Yeah, so our organisation is responsible for the planning and commissioning of NHS services across the North East North Cumbria. If you think about our population of 3.1 million, a large number of those are children and young people and the families that they're connected to, obviously ensuring that all of our population has the best start in life and is able to have a good quality of life and a good healthy life expectancy is at the heart of what we do. This is just so important, I think, in 2024 to think that 2/3 of our children in the North East are growing up in poverty. We know that that can impact their life chances, their education and their health and well-being. It's incumbent, I think, on all of us as leaders to act. This is no longer acceptable and we've all got a role to play here, whether you work in the NHS, in local government or even in a small or big business locally. This is all our responsibility. I mean, I think, you know, we all share this responsibility, but I think our businesses, whether they're the public sector or private businesses employing people, we've all got a responsibility to have flexible policies. We've got a responsibility to make sure that we're attracting and able to provide opportunities for everybody in our community, no matter what their educational background or where they live, what their history is. You know, everybody deserves that opportunity, and we've got to work together. You know, whether or not you're in the health service, other public sector organisations, private businesses or small charities, to use all of our combined expertise and our efforts to do that. So I think the action we're really focused on are our biggest health conditions for children and young people, particularly looking at children and young people, asthma and diabetes, and also tackling healthy weight and obesity as well are some of the core areas that we're really focused on. Probably the most crucial one out of all of these, and in fact what children and young people tell us they want better support with, is their mental health. So we've got programmes of work across all of those clinical conditions, working with our partners to improve health outcomes for our children and young people here in the North East and North Cumbria. We need to take action. So I think it's now our responsibility together. The Mayor has convened us today, which has just been fantastic for this to be such a key priority for the North East Combined Authority. But the action now is on all of us. Individually, what we do when we leave here today, thinking about all of our actions in the workplace and what a positive impact they can have on reducing child poverty, and then what we decide to do collectively and where we choose to prioritise. And I really hope that the Child Poverty Reduction Unit is able to be really clear about the actions, really clear about the priorities, and we all need to be held accountable now to deliver on those.